and Stroke Foundation is raising awareness, as they do every single year, about the burden of cardiovascular disease. It's happening where you might not even know where it is. Under the theme, Use Heart for Everyone and Everything, they're hoping to extend the message to the entire continent. Now, just as I bring in my guest to talk about this, Hayley, the World Health Organization says cardiovascular disease claims almost, are you ready, 18 million deaths a year, or 32% of all global deaths is based on cardiovascular. So we need to take this very seriously, don't we? Hayley Cimring, a dietitian with the Heart Foundation, joining us this morning. Hi, Hayley, good to have you on eNCA. And when you start throwing out numbers like 18 million deaths a year, I think it might get people's attention. Yet we still don't look after our hearts, do we?
Yes, good morning, Gareth, and lovely to be with you this morning. Yeah, so the statistics, as you say, are really scary. Almost 18 million deaths annually, which represents 32% of all global deaths. And it's estimated that 75% of CVD, or cardiovascular disease, occurs in low and middle income countries. And in South Africa, I'll give you our local stats. CVD is responsible for almost 1 in 6 deaths, claiming more lives than all of the various types of cancers combined. So every day, 225 South Africans die from heart disease and strokes, and it's a leading cause of mortality in the country.
And the saddest part about all of it, Hayley, is the fact, the sad part about all of it is that CVD, cardiovascular disease, is quite preventable. It's a decision, it's a bad decision we all make with our diets and how we treat our bodies, isn't it?
Yes, yes. So there are actually some key risk factors that drive the high mortality and morbidity for cardiovascular disease. And among these are hypertension, high LDL, which is your bad cholesterol, obesity, tobacco smoking, excessive alcohol consumption, physical inactivity, poor nutrition, and diabetes. But both these modifiable or behavioral risk factors, that we like to call them, and unmodifiable risk factors such as family history all contribute to CVD onset. But on the positive side, living a healthy lifestyle, which includes avoiding an unhealthy diet, which includes foods high in added sugars, saturated fats, and salt, exercising, staying away from smoking and drinking alcohol in moderation, can all reduce these risk factors.
I suppose it's also very tricky to do, though, as well, because every time I speak to a dietitian, you have to ask the question, Hayley, and you're welcome to weigh in on this as well, is it's very expensive to eat healthy these days, especially with the hours that many people are working and families overburdened. They don't have a lot of money because of COVID. It's just easier and cheaper to eat the junk food, and that's just the state of our society, isn't it?
Yes, unfortunately it is, but on the other hand, there are healthy, affordable options available. So a few tips for your listeners is, you know, they say always eat your fruits and veg every day. Well, if fruit is more expensive, then opt for veggies and always go for the ones in season, because that's going to be less expensive. Then you can also do things like buy in bulk, which is cheaper, and share foods with people. Or when you're cooking, cook a little bit extra and keep the leftovers for lunch or dinner the next day. And so there are affordable ways to spend your money on food rather than the unhealthy junk food.
Yeah, I think it's just an easy habit for people to fall into, especially when you're sitting in traffic in stage 5 load shedding. You just pop in at the nearest fast food place because you know you're not going to have power to cook dinner when you get home either. But I think everyone does take your point, Hayley. There's certainly no argument, so we need to make more effort to eat a bit better. Just in the last few seconds I have with you, Hayley, before I say goodbye, help me understand the theme for this year. Use the heart for everyone and everything. What's the aim of that? Taking it onto the continent, I understand. Very briefly, if you could.
Yes, so that's an important question. Thanks, Gareth. So the overall theme for HAM and what it means to the general public is that this World Heart Federation theme, Use Heart for Everyone, and we have extended the theme to use heart for everyone and everything, is in order to make it more applicable to South Africa and the African continent for humanity, for health, and the environment. And what it is the theme is, it's basically to encourage people to be mindful of human activities and environmental factors that can harm their heart and their brain health.
Well, Hayley, I appreciate your time and all the very best for what is the rest of the month. The Heart and Stroke Foundation South Africa commemorating Heart Awareness Month. That was dietitian Hayley Cimring joining us here on eNCA. It's such an easy thing to do. Well, it should be, but it's just our lives get in the way. It's not an excuse, but our lives get in the way. All right, we've got